Hello everyone. This is the third part of the videos on hemorrhoids or piles and their management. In this video, I'm going to quickly go over certain special situations which one might need to encounter once in a while when one suffers from hemorrhoids. One of the most important and one that really involves the anxiety levels of the patient is when there is excessive bleeding, either as a result of the hemorrhoids themselves or after surgery for hemorrhoids. Under these circumstances, it is important not to neglect this. Your surgeon concerned will also make sure that your follow-up is essentially directed towards avoiding this particular complication. And if there is any excessive bleeding, it is quite likely that the surgeon will have to take you back into the operation theater to do a thorough examination under anesthesia and deal with the problem. Sometimes an area where there has been a stitch put or an area where a needle has passed through might be bleeding, and it might be just a matter of a minute or two to control the bleeding by putting additional stitches and making sure that there is no further bleeding. Rarely, it may be due to the use of the instruments that may have failed or something like that. But however, whatever happens, it is an extremely manageable condition, and that is the most important thing to understand. It can be frightening, but it is not life-threatening. The second situation that I would like to talk about is when hemorrhoids affects a pregnant woman. Now, during pregnancy, the growing uterus tends to press on the rectum and thereby increases the chances for constipation. This further predisposes a person to hemorrhoids or piles. Sometimes, due to the straining at the time of passing stools, these hemorrhoids may prolapse out and may not be able to be deposited back by the person, and it can be extremely painful, and this condition is known as acute hemorrhoidal crisis of pregnancy. The word or the phrase or the term is very big, but it is not as serious as one would imagine. Local cold compresses and use of ointment, use of some Hyalase injections which reduce the local swelling or edema, all these things can definitely reduce the overall effect of the prolapsed hemorrhoids, and in most conditions conservative treatment is more than enough, especially if the patient is in either the first 3 months or the last 3 months towards the end of the pregnancy. In most instances, if it is in the middle of the pregnancy, there is an option for doing surgical treatment for this condition in the form of doing a hemorrhoidectomy and or managing it with other forms of treatment that we have seen before. Either way, once again, hemorrhoidal problems are common in pregnancy, but they are not in any way life-threatening, although it can be extremely discomforting. The last and the most important situation that I would like to touch upon is the occasional occurrence of associated conditions such as fistulas and fissures. These are terms which I'll be discussing in my next video. Suffice it to say that these are benign or harmless conditions that can sometimes coexist with hemorrhoids and will have to be treated by the surgeon concerned in terms of the importance that they demand from the point of view of your symptoms. Finally, one very important thing that is an associated condition that can sometimes masquerade as a hemorrhoid is the presence of a tumor higher up in the rectum. Now, when this happens, hemorrhoids may actually end up being a red herring, drawing all the attention to itself, whereas the problem actually lies elsewhere. Any bleeding from the rectum, therefore, is not to be taken for granted as happening only from hemorrhoids, although they are the commonest cause of bleeding from the bottom end of our back passage. In any case, a clinical examination, a thorough clinical examination done before the treatment is planned out for hemorrhoids by your surgeon will settle this matter. A simple examination using a proctoscope, or better still, a sigmoidoscope, which allows the examination of the lower 30 centimeters of the hemorrhoids, is an extremely important expedient to make sure that pre-existing condition such as a tumor or a cancer is not missed. Let me again not alarm anyone. This is an uncommon relationship, but it should be specially paid attention to in terms of people who present with bleeding from the bottom end, especially if they are in the older age groups. Overall, the management of hemorrhoids, as we have seen before, is very straightforward and capable of being repeated to manage the symptoms as they occur. There is no need to panic if you have any bleeding from the rectum, but it must be checked out at a conveniently early time by your treating doctor. Thank you very much. I hope you found these videos very helpful.